This is All India Radio. In the program Insights, now we bring you a discussion on International Functional Neurological Disorder FND Awareness Day. The participants are Dr. V. Sundar, renowned neurosurgeon and former president of Neurotrauma Society of India and AIR correspondent Vishwapadhyay.
International Functional Neurological Disorder Awareness Day is held every year on April 13th. It aims to promote awareness, support patients, and advance research for the prevention as well as treatment for FND or Functional Neurological Disorder. And today to discuss on this in detail, we are joined by renowned neurosurgeon and former president, Neurotrauma Society of India, Dr. V. Sundar. Welcome to the program, Dr. Sundar.
Very good evening, sir.
Sir, if you can share this with our listeners in very simpler terms, that what is the functional neurological disorder?
Functional neurological disorder, as such, it is not a disease. It is actually physiological or anatomical cause inside the brain. They can purely a psychodynamic activity. They will having the symptoms like a tremor, slowness of movement, abnormal movement, memory disturbance, attention deficit, but without any anatomical or physiological problem inside the brain.
And sir, when we talk about the symptoms of FND and how someone primarily identified that they are or someone is suffering from the FND?
The symptoms, slowness of movement, abnormal movement, like a tremor and then shaking of thing, and then memory disturbances, the attention span will not be there, and speech disturbance will be there without weakness. And some people may have emotional disturbances also. These are all the things. Main components on this neurofunctional disorder. This is a disorder. There will not be any disease. Any disease can precipitate all these things.
Is there any particular age group when the symptoms become visible, or any particular age group people who are more vulnerable?
Yes, this can affect any age group for that matter. But the children below 10, they won't get affected by these things. Women below age of 50 years and men between 50 to above 50, it is equal, men and women. Whereas men population, they are affected early. Below 50 also they get affected. This is the age group. But the elderly age group is vulnerable for neurofunctional disorder because of the changes. This is not because of the physiological or anatomical problem. This is due to the neurochemical transmitter defect.
And Dr. Sundar, what are the triggers that catalyze functional neurological disorder?
Anything that affects the transmission of the neurological conduction can affect. For that matter, epilepsy is caused by neuronal excitation by sodium, dopamine transmitter. Anything interferes in the functions of these substances always produces that trigger the neurofunctional disorder. Like catecholamines, they are the part of the thing. The catecholamine secretions can affect and that will aggravate the already existing the neurofunctional disorder.
Dr. Sundar, there are also a lot of talk in illnesses like these, in disorders like these, about the associated comorbidities, per se diabetes.
Comorbid conditions like hypertension, diabetic, dyslipidemia, emotional, the stresses. The stress means that is also everybody will not have a same emotion to approach any drug. Those who are having emotional disturbances can get affected more. Chronic infections. Nowadays, there are chronic infections. For example, this COVID-19 caused a number of neurological disorders that are not explained. We can come out very clear picture only later because slow viruses that can impede in the brain and they will not produce any anatomical or physiological changes, but they can cause some sort of the thing because now we are studying all these things.
So, Dr. Sundar, can we say that these associated comorbidities become a huge challenge while doing the treatment of FND patients?
Yes, definitely. Because this is one thing, you have to treat the comorbid condition according to the need of the patient. Then also, the chronic illnesses, as the megaloviruses, that is a thing. One among the viruses, recent our events of COVID-19, there was a hypoxia. The hypoxia is a micro changes taking place in the brain, which cannot be seen in any of the investigations. That will be shown as only a functional disturbance in the brain. That is like a neurological functional disorder. So that is maybe a tremor, maybe a slowness of movement, there may be a abnormal behavior, speech disturbance, all these things can happen.
So then, Dr. Sundar, what are the diagnosis or test one has to take in order to check they are suffering from FND?
You have to take a test when the patient is coming with a functional neurological deficit. Basic investigation like a CT scan and MRI is a must. But this will not show any changes in the brain. That is the first and foremost. If there is any problem inside, that is any anatomical or any other physiological thing cannot be, that can be recorded only by EEG, electrophysiological studies of the brain. But these are all always normal to say that is a neurofunctional disorder. This will be done. But to confirm this thing, now let us we have the functional MRIs are available, SPECT scans are available, and PET and SPECT scans. They can contribute to some extent because they will show exactly what is the functional changes happening in the brain can be shown. These are all the advanced techniques that are not available throughout India, but few advanced centers, they are having all these things. But basic, you have to do the regular CT scan, MRI to rule out any diseases in the brain. If there is no disease, then you can go for these functional tests.
Dr. Sundar, here I want to understand from you and ask you a general query. What we have seen with patients is that when they go to hospital, they are pretty confused that who to consult. In case of functional neurological disorder, a patient should consult with a neurosurgeon or with a psychiatrist.
The neurologist is the ideal person because the surgeons, they are mostly taking part in the treatment of the patients who are not amenable for medical management. There are neurofunctional neurosurgery is a one part. Our role is only limited in this thing. But the neurological person is to examine the patient. Even those physician can able to identify early the neurofunctional disorder. There's by clinic testing.
And here I want to talk about the treatment, Dr. Sundar. Is FND completely curable, and to what extent one can live a normal life after going through the treatment?
The FND cannot be cured completely, but it can be controlled. Now that there are modern drugs, they will have a limited side effect. Almost minimal side effect drugs are available. And there are functional neurosurgical work is going on for this functional neurological disorder. That is stereotaxy. There may either a surgery that can be, you can do a electrical stimulation of this thing. There is a stimulation and then you can ablate that area, or you can give a electrical stimulation constantly. These are all the deep brain stimulation. These are all the things, latest development in the functional neuro. This will take care of the patient. And the deep brain stimulation, you will have a battery attached to this thing that the lifespan is 5 to 6 years or 7 years according to the thing. You can change the battery accordingly. You can implant it and do it accordingly. There are specific neurofunctional surgical treatment for these things that will be done. And your epilepsy also is, you can treat by function because the disability caused because of repeated seizures. So the epilepsy surgery is now taking in a good shape. And above all, you can do all these things. You can do minimal medical assistance even after these sort of drugs to be used. Specifically for these tremors, slowness of movement, all these things can be done. And epilepsy also you have to take the drug accordingly. Surgical aspect is a last resort.
So then here I also want to understand from you, Dr. Sundar, that whenever we talk about a patient and their life, how crucial a role the family plays for the patient who is suffering from FND, and what type of care or behavior should they adopt towards the patient?
There is no special care, but at least you have to give a minimum support to them. They may need, because of the problem they have, the neurofunctional disorder, they may need some assistance because it is not a disease. Sometimes the initiation of the movement will not be there. Initiation of movement, there will be a tremor for them. That is called a resting tremor. Most of the time it is a resting tremor for these patients. And the patients will have emotional changes. You have to morally support them. You have to show them that there is somebody is there for them. And the family plays a very crucial role to these patients, because if the family persons are having a basic knowledge about neurofunctional disabilities, then they can assist them accordingly. there is some people may need a special care and special attention. And a well-trained specialist for this thing is also available in physiotherapist, and there is occupational therapist, all these speech therapists, all these people will assist and they will do the needful for this patient. And final and a very needy thing is the family support.
And Dr. Sundar, we are talking about the treatment. So here I want to also understand from you that once a person is going through the treatment, he's taking the treatment, are there any specific dietary changes that he should do? We talked about the exercise as well. What's your take on this?
This is always because of the neurotransmitter problem. Some of the things, especially the drug interaction will be always there. That's why we avoid few drugs when the patient is taking medicine for neurofunctional disorder. Especially B1, that is vitamin B1, is avoided. Because people, when they are having a tremor, all these things, they think it is a weakness of the body and they will try to supplement some of the drugs. That should be avoided. All the drugs to be monitored by the specialist and to be administered according to the need of the patient. And then physiologically, they have to supported by the basic things like day-to-day life activities. Because neurofunctional disorder is a day-to-day problem for them. So the neurofunctional, they have to avoid oil, drugs, diet. And if they have comorbid condition, they have to take diet according to the comorbid condition associated with them.
Entering into the concluding stage of our program, I would like to know from you, Dr. Sundar, are there any precautionary measures that one can take to safeguard themselves from FND? You mentioned stress as one of the major triggers also, so
Yes,
mental well-being equally important as physical well-being, right?
Yes. This is a multimodality approach for these patients, and they must be comfortable emotionally, physically, and mentally. All these things. Emotional aspect must be avoided, and they have to have regular exercise because it is a day-to-day problem. Walking is a difficulty. They will have tremor. They cannot hold the thing. Even they cannot able to take the food. So they must avoid anything which is contributory to this neurofunctional disorder disease.
Here I also want to take some advice and some sort of opinion of yours on this, Dr. Sundar, that how can we create awareness among people about FND?
The awareness program, the patient must report to the doctor. Come early. You can detect diseases early and you can give a lifestyle modification to them in the early stage. They will adopt themselves because if you don't use your brain, that the ideal brain is going for this thing. I am not talking about the early dementia. I'm talking about the dementia that is also a part of the neurofunctional disorder. You have to go and listen. You have to talk. All these things to be taught to the patient other than the medicines which are prescribed for the specific thing. And all these medicines, they have their own limitations and their side effects. So, mostly your emotional aspect, your dietary pattern, your comorbid conditions, maintenance, and your family support, all these contribute to the better thing because the patient may not be the ideal person, but you have to educate the family for that thing and you have to make an awareness. This is purely a clinical assessment. And whenever the patient is affected by these disorders, they will come with the history and you have to listen whatever they say and they have to act accordingly. And that is the earliest. And the Neurological Society of India and the persons involving in the management of neurosciences, they have to educate the people about this neurofunctional disorder. Because socioeconomically weaker section, they may come very late in their stages. They should be educated accordingly. By means of our TV program, every hospital, they have to have a geriatric ward. They have to monitor all this. Now the geriatric age group is going above. And whenever the geriatric age group is above, we may have to face the neurofunctional disorders more and more. And we have to educate them accordingly. And have to treat them accordingly. You have to support them accordingly. And I thank Delhi All India Radio program for educating our people. We also support them in our way.
And with your insightful inputs, thank you so much, Dr. Sundar.
Thank you.
You were listening to a discussion on International Functional Neurological Disorder FND Awareness Day. The participants were Dr. V. Sundar, renowned neurosurgeon and former president of Neurotrauma Society of India, and AIR correspondent Omvesh Upadhyay. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR.